the addiction doctor who couldn't save herself. Addiction specialist Dr. Nora Volkow had built her reputation on one principle. Addiction was a disease that could be cured with the right treatment and unwavering commitment. She had never lost a patient to overdose and had a 94% success rate in long-term recovery. But while Dr. Volkow preached sobriety to her patients every day, she was secretly consuming enough fentanyl to kill 3 people and hiding her addiction so well that no one suspected the most trusted addiction doctor in the city was dying from the very disease she treated. Welcome to Justice System USA, where we explore the hidden struggles behind America's healthcare heroes. I'm your host, and today we're examining a story that asks, what happens when the healer becomes the patient and the expert becomes the victim? Tell me in the comments what city you're watching from, and if you believe these stories of medical professionals need to be told. Subscribe and join our community that seeks truth in the healing arts. The healer's reputation. Dr. Nora Volkow stood in her office at the Riverside Addiction Treatment Center in Portland, Oregon, reviewing patient files that represented some of the most challenging addiction cases in the Pacific Northwest. At 42, she was widely regarded as the most effective addiction specialist on the West Coast, with a track record that had made her a legend in the field of substance abuse medicine. Nora was a striking woman of Eastern European heritage, with sharp cheekbones, piercing green eyes, and prematurely silver hair that she wore in a precise bob that gave her an air of professional authority. She was tall and lean, maintaining the kind of disciplined physical appearance that reflected her philosophy about self-control and personal accountability in recovery. Her office walls displayed the evidence of her extraordinary career: medical degrees from Johns Hopkins and Stanford, board certifications in addiction psychiatry and internal medicine, and dozens of awards from medical associations and recovery organizations. But the most meaningful decorations were the hundreds of thank you letters from patients who credited Dr. Volkow with saving their lives. The Riverside Addiction Treatment Center that Nora had founded 12 years earlier was considered the premier facility for substance abuse treatment in Oregon. Her innovative approach combined traditional medical interventions with psychological therapy, family counseling, and long-term support programs that addressed the underlying causes of addiction rather than just managing symptoms. Nora's treatment philosophy was built on the principle that addiction was a medical disease that could be cured through proper diagnosis, evidence-based treatment, and unwavering commitment to sobriety. She rejected the conventional wisdom that addiction was a chronic condition requiring lifelong management, instead developing protocols that aimed for complete recovery and permanent sobriety. Her success rates were unprecedented in the field. Of the 1,247 patients who had completed treatment at Riverside over the past 12 years, 94% remained sober after 2 years, and 87% maintained sobriety after 5 years. These statistics were so remarkable that medical schools sent students to observe Dr. Volkow's methods, and addiction specialists from around the world came to Portland to learn her techniques. Nora's personal story added credibility to her professional expertise. She spoke openly about growing up in a family affected by alcoholism, watching her father's addiction destroy her parents' marriage and devastate her childhood. Her decision to specialize in addiction medicine was motivated by a desire to prevent other families from experiencing the trauma that had defined her early life. Addiction doesn't just destroy the person using drugs, Dr. Volkow would tell new patients during intake interviews. It destroys everyone who loves them. But recovery doesn't just save the addicted, it saves the entire family. That's why we can't accept anything less than complete sobriety. Her staff at Riverside respected her dedication and admired her results. Though some found her demanding standards and zero-tolerance approach to relapse intimidating, Nora expected perfection from her team because she expected perfection from herself. And that perfectionism had made Riverside the most successful addiction treatment facility in the region. But perfection, as Nora was about to discover, could become its own form of prison when the pressure to maintain it exceeded human limitations. The hidden struggle. Nora's addiction had begun 3 years earlier, though she wouldn't recognize it as addiction for many months after it started. The first prescription for fentanyl patches had been legitimate, prescribed by her orthopedic surgeon after a serious back injury sustained during a hiking accident that required spinal fusion surgery. The surgery had been successful, but the recovery was complicated and painful. Nora's surgeon had prescribed a 30-day supply of fentanyl patches to manage post-operative pain while her spine healed. The medication provided not just physical relief, but also an unexpected psychological benefit. For the first time in years, Nora felt completely calm and free from the anxiety that had been building throughout her demanding career. As a physician, Nora understood the addiction potential of opioid medications and had planned to discontinue the fentanyl as soon as her surgical pain subsided. But the psychological relief provided by the medication was so profound that she found herself reluctant to give up the sense of peace and control it provided. When her legitimate prescription ended, Nora told herself that she just needed a few more days to wean off the medication properly. Using her medical knowledge and prescription authority, she obtained additional fentanyl through a series of carefully crafted deceptions, prescribing the medication for non-existent patients, forging documentation for fictitious medical conditions, and obtaining supplies from multiple pharmacies to avoid detection. The transition from legitimate medical use to illegal diversion happened gradually, with each step rationalized through Nora's extensive knowledge of addiction medicine. She convinced herself that her case was different because she understood the pharmacology of opioids, could monitor her own dosage, and had the medical expertise to manage any complications. But Nora's understanding of addiction from a clinical perspective hadn't prepared her for the subjective experience of physical dependence and psychological craving. Within 6 months of her surgery, she was using fentanyl daily, not for pain management, but to function normally in her demanding professional role. The irony was devastating. The woman who had built her career on helping others overcome addiction was now trapped in the same cycle of dependence, denial, and deception that she witnessed in her patients every day. But her extensive knowledge of addiction medicine made her uniquely skilled at hiding her own substance abuse from colleagues, friends, and family. At Justice System USA, we explore the moments when medical expertise becomes a double-edged sword. If this story is making you question the vulnerability of those we trust to heal us, share it with someone who understands the complexity of human nature. Nora's daily routine became an elaborate performance, designed to maintain her professional reputation while feeding an addiction that was gradually destroying her health. She would arrive at Riverside each morning, having already consumed enough fentanyl to incapacitate most people, then spend 8 hours counseling patients about the importance of sobriety while planning how to obtain her next dose. The perfect performance. Nora's addiction remained hidden because her knowledge of substance abuse medicine allowed her to anticipate and counteract most of the obvious signs that would typically alert others to drug use. She understood which symptoms to mask, which behaviors to avoid, and how to maintain the appearance of normal function while under the influence of lethal doses of fentanyl. Her morning routine began with carefully calculated doses of fentanyl, timed to provide steady blood levels throughout the day without causing obvious impairment. Nora used her medical knowledge to select routes of administration and dosing schedules that would minimize visible side effects, while maintaining the psychological benefits she had become dependent on. She compensated for fentanyl's effects with carefully managed caffeine intake and stimulant medications that counteracted drowsiness without triggering suspicion. Her understanding of drug interactions allowed her to fine-tune combinations of substances that kept her functional while satisfying her addiction. Most importantly, Nora's expertise in addiction behavior allowed her to avoid the patterns that typically expose substance abuse. She never appeared intoxicated, never missed work, never displayed mood swings or erratic behavior, and never showed the progressive deterioration that characterized most addicts' decline. Instead, Nora appeared to be the same dedicated, competent professional she had always been. Her patient treatment outcomes remained excellent. Her clinical judgment seemed unimpaired, and her commitment to helping others appeared unwavering. To outside observers, Dr. Volkow was functioning at the same high level that had made her reputation, but maintaining this performance required increasingly sophisticated deception. Nora developed elaborate systems for obtaining fentanyl without detection, creating false patient records, manipulating inventory systems, forging prescription documents, and establishing relationships with multiple suppliers to avoid suspicious patterns. She also had to manage the physical and psychological toll of consuming dangerous amounts of fentanyl while maintaining a demanding professional schedule. The drug that had initially provided relief from anxiety now created new forms of stress. As Nora constantly worried about supply, detection, and the physical effects of chronic use, the most challenging aspect of her deception was counseling. patients about addiction while experiencing the same cravings, obsessions, and loss of control that she was teaching them to overcome. Every therapy session became an exercise in psychological compartmentalization, as Nora provided expert guidance about recovery while privately planning her next dose. The success that enabled addiction. Ironically, Nora's continued professional success made it easier to maintain her addiction. By providing both psychological justification and practical resources for her drug use, her outstanding patient outcomes and growing reputation created a protective shield of credibility that made colleagues unlikely to question her behavior or performance. The Riverside Addiction Treatment Center was expanding rapidly due to Nora's success, which provided additional resources and opportunities for diverting controlled substances. As the facility's medical director and founder, Nora had access to pharmaceutical supplies, prescription authorities, and administrative systems that facilitated her drug procurement while minimizing oversight. Her speaking engagements and consulting work took her to medical conferences and treatment facilities across the country, providing opportunities to obtain fentanyl from multiple sources without creating patterns that might trigger suspicion from local pharmacies or regulatory authorities. Most importantly, Nora's expertise in addiction medicine made her the least likely person that colleagues would suspect of substance abuse. Her reputation for helping others overcome addiction created a cognitive blind spot that prevented people from recognizing that she might be struggling with the same disease. She treated professionally. Nora's patients continued to achieve remarkable recovery outcomes, which reinforced her belief that her addiction wasn't affecting her professional competence. She convinced herself that as long as she could help others achieve sobriety, her own drug use was manageable and under control. But the psychological strain of living this double life was taking a toll that Nora couldn't fully acknowledge. The constant deception, the fear of discovery, and the physical effects of chronic fentanyl use were gradually undermining the very qualities that had made her an effective addiction specialist. That the escalating danger. 2 years into her hidden addiction, Nora's tolerance to fentanyl had increased to levels that would be fatal for most people. What had begun as therapeutic doses for post-surgical pain had escalated to quantities that placed her in constant danger of accidental overdose. Nora's medical knowledge allowed her to push the boundaries of safe drug use further than typical addicts, but it also created a false sense of security about risks that were actually increasing with each dose escalation. She understood the pharmacology of fentanyl well enough to calculate theoretically safe dosages, but addiction had compromised her ability to maintain the careful control that such calculations required. The physical effects of chronic high fentanyl use were becoming harder to hide. Despite Nora's expertise in managing symptoms, she experienced episodes of respiratory depression that required her to excuse herself from patient sessions, periods of cognitive impairment that made complex medical decisions more difficult, and physical symptoms that required increasingly elaborate explanations. More dangerous were the near-miss overdose events that Nora experienced when her dosing calculations proved inaccurate, or when she consumed fentanyl while under stress or fatigue. She had already experienced several episodes where she lost consciousness for brief periods, regaining awareness to find herself alone in her office with no memory of the preceding hours. Each new overdose event was followed by promises to reduce her usage and return to safer consumption patterns, but the psychological and physical dependence made sustained reduction impossible. Nora found herself trapped in cycles of escalation, recognition of danger, temporary reduction, and inevitable return to higher doses. The most frightening aspect of her situation was the recognition that her medical expertise, which had initially helped her maintain her addiction safely, was becoming less reliable as the quantities of fentanyl required to satisfy her dependence exceeded the levels where precise control was possible. Nora began experiencing what she recognized as symptoms of severe addiction: obsessive thoughts about drug procurement, anxiety when her supply was low, physical withdrawal symptoms when doses were delayed, and loss of interest in activities that had previously provided satisfaction. But acknowledging that she was experiencing the same disease she treated professionally would require admitting that her entire approach to addiction medicine was being contradicted by her personal experience. The expert who preached that addiction could be cured was discovering that knowledge and willpower were insufficient to overcome the biological and psychological forces that drove compulsive drug use. The professional crisis. Nora's ability to maintain her professional performance while using dangerous amounts of fentanyl, began to deteriorate during her third year of addiction. The cognitive effects of chronic opioid use, combined with the stress of maintaining elaborate deceptions, started affecting her clinical judgment and patient care in ways that she could no longer completely hide. She began making minor errors in patient assessments, missing subtle signs of relapse or complications that she would have easily detected in previous years. Her documentation became less thorough, her follow-up care less consistent, and her therapeutic interventions less precisely targeted to individual patient needs. Most concerning was Nora's growing impatience with patients who struggled with recovery or experienced relapses. The empathy and understanding that had made her an exceptional addiction specialist was being eroded by her own frustration with her inability to control her drug use. Addiction is a choice. Nora found herself telling patients with increasing frequency, "You can choose recovery, or you can choose to remain sick, but you can't choose both." The harshness of this message reflected her own internal struggle with the gap between her professional teachings and personal experience. Her staff began noticing changes in Dr. Volkow's demeanor and approach that they couldn't quite identify but found troubling. She seemed more distant from patients, less available for consultation with colleagues, and more defensive when questioned about treatment decisions. Several experienced counselors privately expressed concerns about Dr. Volkow's recent performance, noting that she seemed less engaged with complex cases and more focused on administrative tasks that kept her away from direct patient care. But Nora's reputation and track record provided protection from serious scrutiny. Colleagues attributed changes in her behavior to stress, overwork, or personal issues rather than considering the possibility that their most successful addiction specialist might herself be struggling with substance abuse. The cognitive dissonance between Nora's public expertise and private struggle was becoming increasingly difficult to maintain. She found herself questioning the fundamental principles that had guided her career, while simultaneously doubling down on those same principles in her patient treatment protocols. The close call. Nora's hidden addiction nearly became public during a medical emergency that occurred while she was treating a patient experiencing complications from alcohol withdrawal. The patient, a 34-year-old construction worker named David Romano, was going through severe withdrawal symptoms that required careful monitoring and immediate medical intervention. During the treatment session, David began experiencing seizures related to alcohol withdrawal syndrome, a potentially life-threatening complication that required immediate emergency medical response. Nora had handled dozens of similar situations throughout her career and was well trained in the appropriate medical protocols. But on this particular afternoon, Nora had consumed a larger-than-usual dose of fentanyl to cope with anxiety about her dwindling drug supply and concerns about potential detection of her pharmaceutical diversions. The higher dose, combined with the stress of the medical emergency, caused her to experience cognitive impairment at exactly the moment when David's life depended on her clinical expertise. For several crucial minutes, Nora struggled to remember the correct medication dosages and treatment protocols for alcohol withdrawal seizures. She fumbled with medical equipment, provided contradictory instructions to nursing staff, and exhibited behavior that clearly indicated impairment to the healthcare workers who were assisting with the emergency. The medical crisis was ultimately resolved when other physicians arrived to assist with David's treatment, but not before several staff members had witnessed Dr. Volkow's obvious inability to function effectively during a medical emergency. Her impairment had been too severe to attribute to stress or fatigue. David Romano survived the medical emergency without permanent damage, but the incident triggered questions about Dr. Volkow's fitness to practice medicine and her ability to handle the responsibilities of running a medical facility. At Just System USA, we examined the moments when professional competence and personal struggles collide with devastating consequences. Nora's story shows us how addiction can compromise even the most skilled medical professionals. Dr. Patricia Chen, the facility's assistant medical director, approached Nora the following day with concerns about her performance during the emergency. "Nora, I've worked with you for 6 years, and I've never seen you struggle with a medical situation like that. Are you okay? Is there something going on that's affecting your ability to practice?" Nora's response was carefully calculated to deflect suspicion while providing plausible explanations for her behavior. She attributed her performance to exhaustion from overwork, personal stress related to family issues, and concerns about the facility's expansion that were creating unusual pressure. But Dr. Chen's questions indicated that Naro's colleagues were beginning to notice changes that could eventually lead to formal investigation of her medical practice and discovery of her addiction. The intervention planning, following the medical emergency and Dr. Chen's concerns, Nora realized that her addiction was approaching a crisis point where discovery and professional destruction were becoming inevitable. The elaborate systems she had developed to hide her fentanyl use were becoming insufficient to mask the effects of escalating doses and increasing frequency of impairment. Naro's medical knowledge told her that she was experiencing symptoms of severe opioid addiction that required immediate treatment. But seeking help would destroy the career and reputation she had spent 20 years building. The addiction specialist who had helped hundreds of others achieve recovery couldn't figure out how to save herself without losing everything. She began researching options for addiction treatment that might allow her to maintain her medical practice and professional reputation. Nora investigated confidential treatment programs for healthcare professionals, explored the possibility of self-directed withdrawal, and considered relocating to a different state where she could start over with a new identity. But every option she considered seemed to require admitting the extent of her addiction to other people, which would inevitably lead to professional consequences that Nora wasn't prepared to face. The woman who preached honesty and transparency to her patients couldn't bring herself to apply those same principles to her own situation. Instead, Nora decided to attempt a controlled reduction of her fentanyl use that would allow her to regain professional function without seeking outside help. Using her medical expertise, she developed a detailed tapering schedule designed to minimize withdrawal symptoms while gradually reducing her dependence. The self-directed withdrawal plan reflected both Nora's confidence in her medical knowledge and her fundamental misunderstanding of the psychological aspects of addiction that made self-treatment extremely difficult. Her expertise in the pharmacology of opioid withdrawal was extensive, but her personal experience with addiction had taught her that knowledge alone was insufficient to overcome the compulsive aspects of drug dependence. Nora's attempt at controlled withdrawal lasted 3 days before she returned to full-dose fentanyl, used to cope with physical discomfort and psychological distress that exceeded her ability to tolerate. The failure of her self-treatment plan forced her to confront the possibility that her addiction was beyond her ability to manage independently. The final overdose. On a rainy Thursday evening in March, Nora experienced what should have been a fatal fentanyl overdose in her office at the Riverside Addiction Treatment Center. She had been working late to catch up on patient documentation while most of the staff had gone home, leaving her alone with access to the facility's pharmaceutical supplies. The overdose occurred when Nora attempted to cope with mounting professional pressure and personal stress by consuming a dose of fentanyl that exceeded even her elevated tolerance levels. The combination of high-dose fentanyl with the anxiety medications she had been using to manage withdrawal symptoms created a respiratory depression event that stopped her breathing for several minutes. Nora was discovered unconscious by Dr. Chen, who had returned to the facility to retrieve files she needed for a morning meeting. Dr. Chen immediately recognized the signs of opioid overdose and administered emergency naloxone that she retrieved from the facility's emergency medical supplies. The naloxone injection reversed the respiratory depression and restored Nora's consciousness. But the incident provided undeniable evidence that the renowned addiction specialist was herself struggling with severe substance abuse. The syringe, residual fentanyl, and circumstances of the overdose made denial impossible. Nora, Dr. Chen said, as Nora regained consciousness, "We need to call an ambulance and get you to a hospital immediately, and then we need to talk about getting you the help you need." For the first time in 3 years, Nora was forced to acknowledge the reality of her addiction to another person. The secret that had consumed her life was finally exposed, but instead of feeling devastated, she experienced an unexpected sense of relief that the deception was over. The treatment, Nora's admission to the same type of addiction treatment program that she had been recommending to patients for years, provided her with insights into recovery that her professional training had never conveyed. Experiencing withdrawal, cravings, and loss of control from the patient perspective taught her that addiction was far more complex and challenging than her clinical understanding had suggested. The treatment program required Nora to surrender her medical license temporarily, and step away from all professional responsibilities while focusing entirely on her recovery. The loss of her professional identity, which had been central to her self-concept for 20 years, was initially devastating but ultimately liberating. Working with addiction counselors who didn't know her professional reputation, Nora was able to examine her relationship with drugs, control, and perfectionism without the protective shield of her medical expertise. She discovered that her addiction had been driven not just by physical dependence but by psychological needs that she had never acknowledged. The most difficult aspect of treatment was learning to apply the recovery principles she had been teaching others to her own life. Concepts like powerlessness, surrender, and accepting help from others contradicted the self-reliance and control that had defined her professional approach to addiction medicine. Nora's recovery required her to acknowledge that her understanding of addiction had been incomplete and that her treatment methods, while effective for many patients, had been based on an oversimplified model of how addiction and recovery actually worked. I spent 15 years teaching people that addiction was a disease that could be cured through willpower and proper treatment, Nora told her treatment group during one session. But experiencing addiction taught me that it's much more complicated than that. Knowledge isn't enough. Willpower isn't enough. Sometimes surrender is the only path to freedom. The professional reckoning Nora's addiction and recovery became public knowledge when the Oregon Medical Board investigated the circumstances of her overdose and discovered evidence of pharmaceutical diversion and impaired medical practice. The investigation revealed the extent of her drug procurement activities and raised questions about patient safety during the period when she was practicing while addicted. The medical board's review concluded that while Nora's patient care had remained generally competent throughout her addiction, her impairment posed unacceptable risks that violated professional standards and endangered public safety. Her medical license was suspended pending completion of treatment and demonstration of sustained recovery. The revelation that Dr. Volkow, the region's most respected addiction specialist, had herself been struggling with severe addiction sent shockwaves through the medical community and challenged assumptions about the relationship between professional expertise and personal vulnerability. Some colleagues expressed support for Nora's recovery efforts and advocated for her eventual return to medical practice. Others argued that her deception and diversion of controlled substances represented violations of trust that should disqualify her from future medical practice. The Riverside Addiction Treatment Center faced scrutiny from regulators and patients who questioned whether other aspects of the facility's operations had been compromised by Dr. Volkow's addiction. Several patients expressed feeling betrayed by the discovery that their trusted physician had been struggling with the same disease they were seeking treatment for. But other patients and families who had been helped by Nora's treatment expressed gratitude for her work and support for her recovery, arguing that her personal experience with addiction might actually make her a more effective healer if she could return to practice. The new understanding Nora's recovery process led to fundamental changes in her understanding of addiction medicine and the treatment approaches she had previously advocated. Her personal experience with the disease provided insights that transformed her clinical perspective and challenged many of the assumptions that had guided her professional work. The most significant revelation was recognizing that addiction involved psychological and spiritual dimensions that couldn't be addressed through medical intervention alone. Nora's previous emphasis on willpower and personal responsibility had ignored the complex interplay of trauma, mental health, and existential factors that contributed to addictive behavior. Her experience with the powerlessness of addiction taught her that recovery required accepting help from others and acknowledging limitations that contradicted the self-reliance she had always valued. The control and expertise that had defined her professional identity had actually become obstacles to her personal recovery. Nora also gained appreciation for the courage required of patients who sought addiction treatment while facing potential judgment, professional consequences, and social stigma. Her own reluctance to seek help had taught her how shame and fear could prevent people from accessing the treatment they needed. I used to think that patients who relapsed or struggled with recovery weren't committed enough to getting better, Nora reflected during a speaking engagement about healthcare professionals in recovery. But experiencing addiction taught me that motivation and commitment aren't always enough. Sometimes the disease is stronger than our best intentions. The return to medicine After 18 months of treatment and sustained recovery, Nora petitioned the Oregon Medical Board for reinstatement of her medical license. The process required demonstrating not just sobriety but also competence to practice medicine safely and ethically. Nora's petition included comprehensive documentation of her recovery program, ongoing participation in healthcare professional monitoring programs, and plans for continuing education focused on addiction medicine and professional ethics. Most importantly, her petition outlined how her personal experience with addiction would enhance rather than compromise her ability to treat patients struggling with substance abuse. Nora argued that her recovery provided insights and empathy that would make her a more effective addiction specialist. The medical board's decision to reinstate Dr. Volkow's license was controversial but ultimately based on evidence of genuine recovery, insight into the factors that had contributed to her addiction, and safeguards designed to prevent future impairment. Nora returned to practice with significant restrictions. She could not prescribe controlled substances. Her practice was subject to enhanced monitoring, and she was required to participate in ongoing recovery support programs for healthcare professionals. The transformed practice. Nora's return to addiction medicine was marked by fundamental changes in her treatment philosophy and approach to patient care. Her personal experience with addiction had taught her that recovery was more complex and challenging than her previous clinical understanding had acknowledged. Her new treatment protocols emphasized harm reduction alongside abstinence-based goals, recognizing that recovery was often a gradual process that might include setbacks and partial improvements rather than immediate and permanent sobriety. Nora also incorporated trauma-informed care and mental health treatment into her addiction programs, understanding that substance abuse was often a symptom of underlying psychological and spiritual issues that required comprehensive attention. Most significantly, she began sharing her own recovery story with patients who were struggling with similar challenges, using her experience to demonstrate that addiction could affect anyone and that recovery was possible even for those who seemed hopeless. "I'm not just your doctor," Nora would tell new patients during intake sessions. "I'm someone who has experienced exactly what you're going through. I know how hard this is, and I know that recovery is possible because I'm living proof." Her willingness to be vulnerable about her own struggles created deeper therapeutic relationships with patients who had previously felt judged or misunderstood by healthcare providers who hadn't experienced addiction personally. The ongoing recovery. 5 years after her overdose and professional crisis, Dr. Nora Volkow continues practicing addiction medicine with a transformed understanding of the disease she treats and the recovery process she facilitates. Her personal experience with addiction has made her both more effective as a clinician and more humble about the limitations of medical expertise. Her treatment outcomes remain excellent, but her definition of success has evolved to include progress measures beyond simple sobriety. Nora now considers improvements in mental health, relationship quality, and overall life satisfaction as important indicators of recovery success. She speaks regularly at medical conferences and professional meetings about addiction among healthcare providers, advocating for better support systems and reduced stigma for medical professionals who struggle with substance abuse. Nora's story has become a powerful example of how personal crisis can lead to professional growth and more effective healing when approached with honesty, humility, and commitment to service rather than just expertise. Her daily recovery routine includes ongoing participation in support groups for healthcare professionals, regular therapy to address the psychological factors that contributed to her addiction, and spiritual practices that help her maintain perspective on the true source of healing. "Recovery taught me that being a healer isn't about having all the answers," Nora reflects. "It's about being willing to walk alongside people through their pain and share whatever wisdom we've gained from our own struggles." The legacy. Dr. Nora Volkow's journey from addiction specialist to addiction victim to recovering healer illustrates the complex relationship between professional expertise and personal vulnerability. Her story challenges assumptions about who is susceptible to addiction and demonstrates that knowledge alone is insufficient. Protection against the disease. Her experience also highlights the importance of creating supportive environments for healthcare professionals who struggle with substance abuse, recognizing that shame and fear of professional consequences can prevent people from seeking the help they need. Most importantly, Nora's story shows that personal experience with the diseases we treat can enhance rather than compromise our ability to heal others, when that experience is processed through recovery and transformed into wisdom and compassion. The addiction specialist, who couldn't save herself, ultimately became a more effective healer by learning that true expertise comes not from having all the answers, but from understanding the questions that matter most. This has been Justice System USA, where we explore the hidden struggles of those who dedicate their lives to healing others. Dr. Nora Volkow's story reminds us that healers are human beings who face the same challenges as their patients, and that sometimes the greatest medicine comes from shared experience rather than professional distance. What did you think about Dr. Volkow's journey from expert to patient to healer? Have you ever struggled with addiction or watched someone you trust battle this disease? Share your thoughts in the comments and tell us what city you're watching from. If this story opened your eyes to the complexity of addiction and the vulnerability of healthcare professionals, hit that like button. Share it with someone who needs to understand that healing often requires healers to be healed. And subscribe to Justice System USA for more stories about the human side of medicine. Remember, the people we trust to heal us are human beings fighting their own battles, and sometimes the greatest healing comes from those who have been patients themselves. Until next time, be kind to the healers in your life. They need healing too. See you next story.